your questions about your sexual health and sexual priorities, needs, and preferences are the basis of these podcasts. And because of that, I want to answer some really important questions that have come up over the past few weeks since I started doing this podcast. Hi, I'm Dr. Neelima Deshpande, and this is V for Vagina, the podcast that dispels myths and misunderstandings about the vagina and empowers women to embrace their sexual energy, vitality, and well-being. In this podcast, I'm accompanied by Niranjan Medekar, the CEO and founder of Sounds Great, the company that helps me create and market this podcast. Niranjan is an amazing creator, writer, columnist, and an author, and his podcast, Sex Verbal Bindas, which is showed on Storytel, is one of the most listened podcasts in Marathi. He's here today to help me sort through the hundreds of questions I've started to get on social media, and as well as in response to the podcasts I've done here before. A lot of these questions are very personal, very intimate, and I needed help to sort them out. Thank you, Niranjan, for helping me to answer these questions.
Hello, Neelima ma'am. Thank you so much for the great introduction. Yeah, and we start with the questions. The first question is from Amruta regarding breast size. She asks, "Hi ma'am, it's so nice to listen your podcast. They are very informative. I have small breasts with cup size of maybe A from childhood. And at the age of 42, my desire of having a good breast still didn't die. If any estrogen supplements will help me increase my cup size by 1 or 2 cups. I don't want to leave a chance if I have any, and so I am asking."
Thank you. This question is very important, and many girls and women have a problem with their breast size. Sometimes it's too big, sometimes it's too small, and most women are so self-critical about their bodies that they don't like the size they've got. Sometimes one breast is larger or smaller than the opposite side. Typically, if you're 42, I wouldn't recommend hormone supplements to increase your breast size, because we know as you get older, the effects of estrogen or other hormones on the breast tissue are not what we might want them to be, particularly if the risk for breast cancer is considered. So if you're really, really concerned, then I would suggest that you see a plastic surgeon and discuss the option of using plastic surgery to increase your cup size.
Okay, that's very informative. But usually, as a medical practitioner, what would you recommend? Is it necessary?
Your breasts don't need to be a certain size to function well, and nor do you need to have a certain size breast to appreciate yourself in the mirror. One of the most important exercises I do with my patients and clients who come to me for sex therapy is an exercise in self-appreciation, especially in the mirror. See, our body image is defined by what we understand from society and culture about what your body should look like and how big your breasts ought to be. It can also be about our own perception. So you might perceive that size A breast size is too small. You might have a look at your breasts and say, well, actually, intellectually, it's probably too small because it won't function very well. So you might have questions about its functionality. And the last reason you might criticize your body image is because you look at it from an aesthetic point of view or a comparative point of view and say, oh, well, my friends all have breast sizes of this size, so I should as well. And the truth is, your breast size doesn't define your attractiveness to your partner. It doesn't typically define how well they function, because now you're 42. If you've had children, then you know that the size of your breast doesn't actually determine how much milk you produce for your kid. Typically, as you go through menopause, most women's breast size does increase because the glandular tissue in the breast decreases and you start to have a bit more fat deposition. So most women going through menopause will actually find that their breast size does increase by a cup size or so. Having said that, your breast size also changes with your periods. So with fluid retention, premenstrually, all these times are when your breast size can increase. If you lose too much weight, your breast size can decrease. So somebody who's got a C or a D cup might find that, it was a good size when they were a certain weight and then they decided to lose fat. And when they lost fat, they lost more fat from their breast than they did from the hips and tummy. This is common as well. So really, your life cycle will also determine your breast size. You're not always stuck with the breast you were born with. We also know that as you get older, heavier, droopier, fattier breasts are harder to diagnose breast cancer in. And as we know, as we get older, our risk of breast cancer increases. So it might go even up to 1 in 5 of us as we get older. And particularly with the kind of environment we live in today, breast cancer is very common. So thinner, smaller breasts are actually easier to make a diagnosis in. Touch wood, not that I want anybody to get breast cancer, but it is worth considering as you get older. So I would ask you to take a very critical look at yourself in the mirror and say, what is the belief behind me wanting a particular size of breast? What is it do I need my breasts to do at a particular size? How can I be grateful for the fact that my breasts are healthy and that they've served me well through these 42 years? And even after addressing all these limiting beliefs, if you still think you need bigger breasts, then do have a conversation with your surgeon, with your doctor, so that you understand all of the risks and benefits of getting a breast implant. I would certainly not recommend estrogen supplements at this age. Estrogen supplements are maybe suitable or may have been suitable when you were younger, when you were a teenager. And certainly we don't prescribe estrogen supplements just because somebody wants bigger breasts.
Thank you for the recommendations, ma'am. We'll move on to the next question, which is from an anonymous listener who says, I have been sexually inactive for 2 years now since I am single and do not want to indulge in any casual sex anymore. What can I do to keep my vagina flexible so that when I finally have sex, it doesn't pain me much?
This is such an interesting question, and I'm glad somebody asked it. If you're a younger woman, having regular sex automatically allows your vagina to accommodate. You don't really need to do anything to keep or maintain the vagina to be flexible. The vagina is already flexible. It's not a rigid pipe. Also, sex doesn't have to be painful even the first time you have it, leave alone subsequent times that you have sex. There is nothing much you need to do to keep your vagina flexible if you don't want to have casual sex. When you do start having sex, it's more important that you have sex with somebody you really, really want to. You have sex with somebody that you can take your time to get aroused and indulge in foreplay for the time it takes you to get comfortable with that person. And until you're ready, it's probably best not to proceed to intercourse. The worst thing you can do is to attempt intercourse when you're not aroused and you're not lubricating, because that for sure will be uncomfortable. And once you have an uncomfortable or painful episode with sex, then you anticipate it to be that way. And you don't want that, right? Now, if you're an older woman, menopause, and I've talked about the vagina at menopause at length in previous podcasts, if you're sexually inactive for any length of time, once you've gone through menopause, or once you know that your vagina is drier and you don't get aroused it easily, the problem becomes that the vagina gradually and progressively becomes shorter, thinner, more fragile, and less accommodative. It tends to lose its flexibility over time. And intercourse is a really, really good way to keep your vagina flexible and also to exercise your pelvic floor muscles. Now, if you don't want to have casual sex, a good alternative is to use a vibrator or a dildo. Now, you don't want to just use the vibrator to masturbate around the clitoris. You want to use it inside the vagina. Make sure you cover it with a condom and use a water-based lubricant when you do masturbate with the vibrator inside your vagina, and remember to contract and relax your pelvic floor around it. Although it's a poor substitute for great intercourse, it'll at least help you acclimatize to feeling and stretching the vagina around something. So when you do meet somebody you want to have great sex with, it'll be less uncomfortable. Also, if you're suffering with vaginal dryness discomfort, go see your GP or your gynecologist and get some vaginal estrogen prescribed so that some of the rugosity of the vagina, some of the glandular activity in the vagina can be maintained. You'll find this makes life a little bit more comfortable for you as well. And that constant dry sensation around the area of the vulva and vagina decreases. It'll also make it easier for you to pass urine. I hope this helps.
Thank you for the insights, ma'am. Actually, the next question is also related to vagina. And Madhura asks, is vulva itching normal a week before and after periods? Which type of vulva itching is normal for women?
It's interesting you ask this question because we have talked about how the vulva and the vagina are two separate things. The vagina is the organ inside your body from where you get your period, and the vulva is the area on the outside of the body, which consists of the hair-bearing area, which is called the mons, the two labia on the outside, which are called labia majora, the labia minora, and the clitoris, and then the entrance to the vagina, which is called the introitus, and the perineum, which is the area in front of the anus. So typically, I'm assuming what you're asking is that the area of the introitus, where the period blood comes out, and the area of the labia minora is where you're experiencing itching. Sometimes this itching can extend behind towards your anus and occupy the area of the perineum. No itching is normal. That's the truth. Now, if you're experiencing this a week before your periods, then I would suspect it's related to probably an infection, probably a yeast infection that's getting triggered by the levels of, as the hormone levels change. But if your itching is restricted to period and a week after your period, then it's very likely to be an allergy to the sanitary towels you're using. So we need to understand that itching is a response of the skin around the vulva to something that's either coming on it or something that is touching it. So something that's coming on it is very likely to be a discharge or an infection from inside the vagina that is coming out and then touching the skin to which it's reacting. And very, very commonly, itching is related to a yeast infection or a candida infection. So it's worth getting checked out for that. And usually candida and yeast infections do flare up around the time of the period because the pH of the vagina changes. Now, if the itching is happening during the period and afterwards, and it's very likely because of a sanitary towel, it may be because of the material that's used in the sanitary towel, or very, very recently, sanitary towels have started including perfumes or deodorants because women complain of smell when the blood comes out. So it's important to change your sanitary towel, or if you're open to it, you can switch to using something like a menstrual cup, which helps you to avoid using sanitary towels or tampons for long periods of time. The other thing that could be useful is to change your sanitary towel frequently, so every 4 to 6 hours, rather than wearing the same sanitary towel all day. Wearing a damp sanitary towel for a long time can result in chafing, which is where the damp tissue rubs against the delicate skin of the vulva and causes small tears that then, as they're healing, start to itch. Sometimes you can solve this problem by applying a small amount of coconut oil or olive oil to the vulva during your periods soon after you've washed it. When you do wash, make sure you don't scrub your vulva. Just use normal water and a pH neutral soap if you do need to use a soap to clean, if you find it smelly and you want to clean up. For sure, don't scrub the area. Don't wash inside the vagina. Your vagina is a healthy, self-cleaning organ. It doesn't need washing out or douching. So be sure, even during your period, whatever is coming out is perfectly natural and it's meant to come out that way. So you don't need to clean inside the vagina. I hope these tips are helpful. If in doubt, and if it lasts for more than a week, and you've noticed that it's not healing or the vulva becomes red, because remember, I've also asked you to take a mirror and have a look at your vulva regularly. If you find there's any changes out there, any changes in the skin compared to what they were before, go and get checked out and ask your gynecologist to have a look. For sure, don't use any kind of creams or emollients across the counter, because a lot of them do contain steroids and they change the architecture of the skin so that a diagnosis becomes much harder to make. So I hope this was helpful. And go and see your doctor if you're in any doubt.
Absolutely, ma'am. That's very helpful and informative. The next question is from one of the male listeners, and it's a very good sign that V for vagina is, even though it's for on woman sexual health, many male listeners are also keenly following it. So the next question is from Rohit. He says, we mostly use coconut oil as a lubricant. Is it okay or should we avoid it, especially if we are planning a pregnancy?
If you're planning a pregnancy, the last thing you want is to use something that stops the sperms from reaching the egg. In a man's body, the sperms are mixed with their own fluid that's created from the prostate gland and from the seminal vesicles to feed the sperms and to keep the sperms alive until they reach the egg. If you mix it up with coconut oil, you're going to stop these sperms from reaching where they're supposed to reach. Because coconut oil, it might be a lubricant for your penis and the vagina, but it's not a great lubricant for sperms. What you need to be using is a water-based lubricant that is suitable for couples who are trying to get pregnant. And usually this is something like KY jelly or Lubic gel, which doesn't have many additives. Particularly, it doesn't have things like glycerin or potato starch. Water-based lubricants are good, but an even better lubricant is actually just your saliva. It is very natural. It is on unlimited supply, and you don't have to worry whether you have it or not. So a lot of times when I have couples who are looking to get pregnant and they're concerned about using a lubricant, I say to them, the first key thing is to get aroused. It's very important not to treat sex as work. Sex is incredibly pleasurable for couples. It increases intimacy. It improves closeness. It releases the hormone oxytocin, improves bonding. There are all many, many wonderful reasons to have sex. When you have great sex that's really, really enjoyable, getting pregnant is a very happy side effect. If you're planning a pregnancy, it's not necessary to have timed intercourse. In fact, timing your intercourse can put a lot of stress. It can make you come under pressure and get anxiety because you've got to perform on a certain day at a certain time because somebody's ovulation test has come positive, and it becomes tedious. Remember, you don't particularly like going to work on a Monday morning, do you? So if you make sex like work, then you're going to try and avoid it rather than enjoy it. So my suggestion would be, have great sex. Enjoy your sex. Use a water-based lubricant if you need it. Better if you can help each other get aroused. Focus on getting the vagina really, really, really wet and lubricated. If you need help, your first resort could be your own saliva. And have sex to have fun. And then your pregnancy will be a very happy side effect.
Thank you, ma'am. The next question is from Namita. And the question is, I and my partner have been living together since last 2 years, but we never attempted intercourse due to fear of pain. Does the first time sex pain very bad?
Not being able to attempt intercourse because of fear of pain is a very common problem. In fact, in any kind of sexual medicine practice, this fear of pain that stops couples from consummating their relationship can constitute nearly 50% of the cases we see. And that's just the tip of the iceberg, which means there's a huge number of people out there living together or married but not having sex because they're afraid of pain. And there's a myth. There's a myth about virginity. There's a myth about sex being painful. There's a myth that the first time you have sex, it has to bleed. And it all boils down to how you were educated about sex in your youth and childhood. All of these impressions about how sex has to be painful and uncomfortable, especially for the woman, leads to this problem which is so extensive. To answer your question very simply, the first time you have sex does not have to be painful. It doesn't even have to be uncomfortable. A lot of it goes down to the relationship, the communication between the partners, how much time you spend on foreplay, how aroused you get, what are your conditionings around enjoying sex, what are the deep messages about your body enjoying sex and pleasure. And if you welcome it, then intercourse is not painful. I address this topic in a lot more detail in my podcast about painful sex and in the workshop I do for women who suffer with pain or fear of pain with intercourse. Having said that, fear of pain with intercourse also happens in men. And you might wonder why. But men who have a very tight foreskin or who have a history of maybe an infection or pain because of other problems inside the penis can also be inhibited to have intercourse because of the fear of pain. So if you're a man and you're listening to this and are worried about pain with intercourse, do go and see your doctor and get referred to a urologist or an andrologist to be examined. Without examination, the cause of your pain can't actually be found and treated. And the treatment does not need to be complicated. When a couple comes to me with the complaints of painful intercourse or being afraid to attempt intercourse because of pain, I go through a process for sex therapy. I talk to them about history taking, about going back into their past to discover why they have these beliefs or inhibitions. And then there's a considerable amount of work that goes into the couple relationship to help them have better sex together. So it's a process. It's unlikely to be something that gets resolved in just one visit. So if you're somebody who has this problem, be prepared to go and see a gynecologist or a sex therapist who specializes in this problem, and also be prepared to put in the work that you're going to need to put in to make sure that you have great sex.
Thank you, ma'am. Here is the last question regarding irregular periods. It's from Rahi. She asks, recently I got an issue about my menstrual cycle. I got them in just 18 days last month and in this month after 24 days. What may be the reason for it?
Irregular periods, the way you describe them, are very common. There are several triggers for irregular cycles. It may be related to stress, it may be related to abrupt weight gain or weight loss, it may be related to dysfunctions in your hormones, especially if you've got a problem with your thyroid gland. Sometimes irregular periods can follow taking something that we call an emergency contraceptive. So if you've taken something like an eye pill or an unwanted 72, that can make your next cycle irregular, maybe delayed or come early or may bleed a bit more. My suggestion would be that you keep a diary of your periods for at least 3 months and then see your doctor about it. A normal period cycle or normal menstrual cycle lasts for anywhere between 3 to 7 days, and the cycle itself can be 28 days plus or minus 7 days. So anywhere from 22 days onwards to 35 days is a normal cycle. Having said that, there are women who have a longer cycle, maybe 35 days or 40 days, but it's very regular and they can predict exactly when it's going to come. That is fine as well. Just keep a diary, evaluate it, and go and see your doctor if you have any concerns. Thank you so much for your questions. It really informs all of the topics I cover in my podcast. Do keep them coming, either on my Instagram handle or via my website. Until next time. Remember to like, subscribe, and share this podcast with whoever you think needs to hear it. If you'd like to talk to me one-on-one for a personal consultation, get in touch with me via my website, www.dr.neelima, Neelima, Deshpande, Deshpande.com. And you'll find a button there where you can click and book a slot with me. And I'll be sure to respond to any of your queries. Thank you. Disclaimer. This podcast is for general information purposes only. It does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. No doctor-patient relationship is formed. The use of this information and the materials linked to this podcast is at the user's or listener's own risk. The content on this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment.